I started dialysis August of 2022. They put me on the machine. I fall asleep, and then they waking me up saying it's time to go home. It's being vain, I guess. I know you're not going to be young forever, but you don't want your health to fall off like that. My name is Jane Patterson, and I live in Stanton, Virginia.
Kidney disease doesn't pick favorites, but if you were to look across the population in America, if you're older, if you're non-white, if you're poor, if you're Medicaid and Medicare, that means you're both older and poorer, you tend to have higher rates of kidney disease. Patients who are most likely to suffer from chronic kidney disease are those who've had multiple things leading to it. So they are those who have not just high blood pressure or just diabetes, they often have both.
I've lived here for 66 years. My past health issues, I've had high blood pressure since I was 18. And then as I got older, other stuff started happening. I have arthritis in both knees, high cholesterol, sugar, diabetes, and then the kidney failure.
Unfortunately, we know that Black individuals are 4 times more likely to be affected by chronic kidney disease and end-stage kidney disease, and why that is the case is complicated and not related to their race alone, but rather social determinants of health. So for example, what is their access to health care? What is their access to preventative and primary care? Their access to healthy foods, their environmental exposures that they may or may not have. So I think there's a lot of factors there that are contributing to this disparity in who is impacted by chronic kidney disease.
I worked third shift for 22 and a half years. I worked from 10:30 to 7. So when I got off, I would go to the grocery store, come home, sleep, get back up, cook, sometimes not cook. My husband had high blood pressure and sugar. He had both of them at the same time, and as time went on, his kidneys started to fail, and then he had to start going to dialysis. I was working 7 days a week and taking care of my husband. I had a busy schedule, and then I still had to take care of myself too. At the time, I was so busy that I had to eat a lot of fast food. My primary care doctor sent me to the kidney doctor because I kept swelling, and she couldn't get my blood pressure in line. So that's when she said that I need to go to the kidney doctor. And we fought it, but I think it was about 3 years. And then he said that my levels was dropping. And then he finally said I had to go on dialysis. I have edema of the feet and legs, so they swell. So that's why I had to quit working. What I'm doing 3 days a week is I'm coming to dialysis. Dialysis to me is a part-time job. I know on dialysis days, there isn't much that I can do. I'm not able to do anything, I could say anything on those days except go home, warm my food, get something to drink, eat, and sleep. So once I get my sleep in, it's like I'm rejuvenated again. I feel not 100%, but a whole lot better than when I started, because when I started, I could barely move, walk, or anything. Within 4 months being on dialysis, I was feeling a whole lot better. Dialysis is going to help me live longer, because I have nieces, nephews, great nieces and nephews, and great-great nieces and nephews that I want to see.